Hello. Thank you for joining Let Me Know If You Need a Podcast, the show where we talk honestly about what it means to ask for help and receive help, more importantly, and then survive those moments that change everything in life. Today's episode is funny and deeply real. We are happy to be joined by Kay Hsu, who is a creative leader in the tech space. She's a healthcare advocate and a stage 4 cancer survivor. Kay takes us inside her journey from diagnosis to advocacy and shares what it was like to hear the words, "you have cancer," and channel her inner wiliness to get inside and fight a complicated healthcare and insurance system. We talk about mental health, biochemistry, treatment, insurance battles, the emotional toll that all of these things take on being a patient and often leaves them to fend for themselves. So Kay reminds us that self-advocacy is a skill, finding resources is a skill, and sometimes it starts with letting yourself ask for help. This conversation is about permission to get angry and turning advocacy into influence. Let's get into it.
Hi, everyone. Welcome back to Let Me Know If You Need a Podcast. Today, Kristen and I are sitting down with someone Kristen knows very well, and I'm going to learn about on the spot, which is going to be really exciting for us. Kay, welcome to the podcast. I'm going to let Kristen do a little introduction from what she knows, and then we're going to drill you with all the questions.
So thank you, Amy. Kay, we're so excited to have you. Kay is, in one word, in the simplest terms, a badass. She is not only just an incredibly successful professional in the tech and creative space, but also is a stage 4 cancer survivor and thriver right now currently. And what I admire most about her is recognizing opportunities to take her trials and tribulations and push it for the greater good of people, primarily in the insurance space. So I would love to kick it off to Kay and just let's hear your origin story, start to finish, and we'll start from there and we can kind of dive in.
Cool. Hi, everybody. First of all, thank you for inviting me. I'm so pleased to be a part of this. A lot of times people come to me and ask me, I have a friend who just got diagnosed. I know that you're really busy. I know you don't have time to talk to them, but I always make sure that I talk. It's one of the most important things that I do. It's not just even about insurance, but helping people connect to resources. Because when you get diagnosed, I got diagnosed for the first time when I was 35. There is no resources. You cannot Google your way out to find who's a good doctor, who's a good surgeon. Sort of like the healthcare system that we have leaves you on your own to figure stuff out. All to say, your actual question is it actually harkens back, Kristen, when we worked together, because obviously I got diagnosed then. But I remember very distinctly when I got diagnosed, and it sticks out not just because it was a big moment, but it was a big life lesson for me as well. I had a normal pap smear and OBGYN appointment due. It was annual exam, no big deal. But I'd missed it the year before. I remember in the January, I was walking with a colleague in between a meeting, and I said, hey, this work meeting got put on, and now I'm going to have to move my OBGYN. It's so difficult to get an appointment. I don't know what to do. And she said, part of my New Year's resolution is to not ever miss a doctor's appointment because of work. And I really want to encourage you to do the same. And it was really because she said that to me that I decided to keep my appointment. Because if I hadn't, it could have been a much longer period of time. Knowing me, I thought I was young and healthy. I probably would have put off this appointment for another year. But because she said that to me, I really took it to heart. This is Jess Sherritt's, by the way. I went to the OBGYN, and the woman, the gynecologist said, hey, you have a lump underneath your breast. Did you know that you had this lump? Here I am thinking that I learned, I went to all-girls school. I learned to do my own, diagnosis and check in the shower. I thought I was doing it correctly. I was not, because there was a pretty big lump there, and it was confusing. It was just right under the nipple duct as well. So it was a little bit confusing. All to say is that I had a feeling already. But subsequently from that moment on, from that check, getting a biopsy and ultrasound and all that stuff, I kind of had a feeling that something was a little bit amiss. And the moment I found out, I was actually at a work dinner. OBGYN called and called and called. So I knew there was something, because typically people don't really call you after a test result, and they're not trying to desperately look for you unless there was bad news. Right. So I found out during that dinner call, I left immediately, and then I sort of had to process the whole thing. But it was fairly difficult at that moment. And knowing myself, and I would say most women, my mind, even within the next 2 hours thinking, what is my next step? Yep. How do I find a doctor? What I do? How bad is it? And it started to go into like a whirlwind.
You were in like problem solving mode, right? And so like, where were you in your personal life? Like you were living in New York, I remember. Did you have Freya yet? Were you married? What was your circumstances?
This is even probably even a bigger point in the story. I just met my now husband. We'd been going out for a year. Again, I was 35 at the time. So, we were looking to get married very quickly. And this sort of came in between. I always joke that I was not a pity. It was not a pity proposal.
I already knew him.
We planned to get married before, and I found out I was diagnosed after. In retrospect, again, I think it's funny because he definitely knows me a lot longer as a cancer patient than not as a cancer patient, which is very interesting. And then I think the second part of it is just how much people underthink the journey of the caregiver or people around you. Like that is such a big part of how people actually survive. Like there's a lot of longitudinal studies now on people who are long-term survivors and what are the components within their life. It's typically very different because it's all biochemical, if you will. But they also did find like a very strong social support system was often what most long-term survivors had in common. So again, that's been really interesting. I didn't have Freya. I had her through a surrogate.
That's right.
Who's
during
Freya?
COVID. Freya's my daughter.
I was hoping you were going to say a dog because I'm dying for someone to have a surrogate through a dog, a dog surrogate.
I would love to have a dog surrogate and a dog, as long as, I didn't have to pick up the poop.
Yes.
I named Freya after my oncologist surgeon.
Oh, you did? So how cool is that?
Isn't such a great name? I love it.
That is
the most amazing woman.
So before we go on, I got to ask I need to get more information. Did you keep working? Like that's a huge, okay. So like when you got the information, did you know that it was advanced at that time, or were you already stage 4? Did you know?
No, I was stage 3. And then they had to resize it. I think I ended up maybe size. I think it started out with them suspecting through ultrasound that the size, it hadn't spread at the time. They thought it was maybe like late stage 2 or again, early 3. I think at the ending and started at 3. However, I think in my now 10 years journey of learning about cancer, I think that's all quite artificial. I think it's like a good guess. I mean, stage 4 is very obvious because it spreads. It's just a different thing. But I think the staging is very, it's not all the information.
Not
and
exact
that's why
science.
I try to I try to tell people you have to put that in context. Don't let the stages scare you.
Yeah.
Or on the other end, don't let the stages also make you think that you're sort of you don't maintain sort of a healthy lifestyle. Once you've sort of dealt with it as well. It's sort of an artificial thing because it really depends on how you found it, where you found it, but also size, but also biochemistry, because there's other elements of knowing your disease where maybe a growth or a hormone or a type of cancer probably matters a little bit more about prognosis.
So you get all this information, and then I know when I got all that information, I mentally had a very hard time going back to work. I could not focus on work because I was all the other things that you're thinking about, right? So were you able to keep working?
Yeah, I worked.
You are a badass. Okay.
Well, no. And by the way, I think that's so funny because a lot of people look at it that way, but it really is definitely a protective mechanism, right? It's the one thing that's very comforting. It's steady. I felt a lot of comfort knowing that if I did my chemo on Thursday, then I can work from home on Friday and I'll be back to normal on Monday. But a lot of it was giving me a goalpost so that it didn't feel very overwhelming. So even though it might come off as something of strength, I would just honestly say it was survival.
Yeah. It's personal preference. It's that's what worked for you. That's that's a really powerful message.
When you're by yourself, everybody else is working. So you're I'm just going to be alone with my thoughts. It's even worse, to be honest.
Nobody wants that in my head. I don't want to be alone with my thoughts.
I love to be alone with my thoughts, but I can understand how it's a personal journey. I just love to be alone. Anytime I can be alone at this point. So at some point, can we revisit the pre-cancer you and the post-cancer you? Because I think that topic is but I'll not hijack the entire conversation.
No, please. This is a conversation. So yeah,
okay,
go for it.
We didn't really give you this information ahead of time, but when you said it, like, have you and your husband had conversations about the post-cancer you? Because I feel like I'm much different post-cancer, physically, mentally, priority-wise. Do you feel that?
You know what? It's really interesting because I honestly, to be honest with you, I probably have come out of it recently. I don't think we knew. I mean, obviously we didn't know, but all of a sudden I got diagnosed. My amazing oncologist surgeon was like, get your eggs out. I didn't even understand that you couldn't have kids. I had no idea. I was just like, all right, I'll do whatever the doctor tells me to do, and sort of get rid of it. So we went through a lot of things that much quicker, I think, than a normal couple would have gone. Like, going through making embryos, you have to sign a lot of legal papers. You got to figure out, like, if one of us passes, what's going to happen with it. So we were sort of forced to think about that and, religion and all of these things probably before we normally would be. So that was a little bit of a weird ripple thing. And even if you know someone at 35, you still don't really know them. So I don't even know if I know how I would be anymore, because this is just the only person I know. Having said that, like, a lot of oncologists have been very explicit with us, like that there is real biochemical stuff that happens to your brain. Some people do have inflammation in the brain when you're going through chemo. There's a lot of side effects. Obviously, estrogen loss changes everything. It's definitely changed, like desire and output and things that, again, felt more quote unquote normal. But even, again, having someone verbally tell you this stuff, it doesn't change the fact that when it's happening, it's very difficult to process, I'm sure, for him. And we've had many conversations because, it's not quote unquote personal, but it is personal. Like, that's the reality that you have within your relationship. And I've been very lucky that my partner is incredible. We really had to think about how to shift our dynamic. I was more of the caretaker, like, by personality. And then all of a sudden that switches, right? Like, I have this expectation because I'm the sick person that you are going to do all these things for me. And I think we had to navigate that, at the 1 year mark of our relationship, get married. We sort of rushed all of that. And again, long-winded story, but all the way to today, I recently just shifted my medication because I had a metastasis last year, which, forced a little change in treatment. I realized after I got off of that last medication how depressed I was. Hugely depressed. I think the medicine just, like, took my body to a different place, body health. But I think also the side effect was a lot of depression, which happened over the course of 6 years. So it wasn't even like a very obvious thing where, like, I was just depressed one day, where I think it's slowly the toxicity of the medicine accumulated. And it wasn't until after I got out of this that my partner said to me, like, you're the original person that I married. Like, you're full of light, you're more social, and again, it's all, in a way, not to blame it, because obviously there's a lot of things that happened in the last 6 years. But I think a large part of it was, I think, the biochemistry of, like, that medication and how hard it is on your body and how it could really affect your gut, obviously, but also your brain and how you process things emotionally. So it's an interesting question because I don't know who I am. I'm probably the same person throughout, but just with different, kind of different elements padded on top.
Do any of us, really?
I know, right? It's day by day for me. So Kay, you mentioned, like, this biochemistry. You have, like, a zest for work. You have a creative brain. I know this firsthand. How did this impact your work and, like, what you do as a storyteller, as, like, a brand queen? Like, did this impact work for you and, like, from a mental capacity? At
first, especially with chemo, because that was, again, in the early days, I feel like that was easy time. I was very conscious of how I looked. I mean, obviously, right? I lost a lot of weight. I was conscious of how I looked. I remember a colleague who was fairly new at the company we both worked at had said to me, oh, like, great haircut. Because I'd cut it to kind of preempt the hair falling down. She's like, great haircut. Like, what prompted this? I was like, chemo. It wasn't like a purposeful thing. So I was very conscious of it. I was conscious of having all these hot flashes. So again, I, do a lot of presentations. So feeling very self-conscious that if I'm standing in front of, clients or, in front of a bigger group of folks, all of a sudden you're sweating, you're dripping sweat.
Yeah, you look
and
nervous.
It does not look normal.
Yeah. Yep.
Just like, and it's just on your face and you're turning red. So I was very conscious of that. Definitely. I don't think that I suffered too much brain fog, or I didn't really have sort of a lot of the more common side effects from chemo or radiation. I will say that probably as I moved to stage 4 and metastatic breast cancer, I have experienced a lot of that. So I'm less, as of age, less self-conscious about how I look, but I'm much more self-conscious about the fact that I forget words all the time. It's a lack of estrogen in your brain. Like, people think of estrogen just as a sex hormone, but it's not. It's for your heart. It's for your brain. So I have very bad short-term memory. And again, when you're presenting in someone and that word just will not get to, the front of your mouth, it's so frustrating. Sometimes Tony jokes and he goes, "Spit it out, Kay. I know you have it in there." And I'm like, the word couch. Yeah. That's the word I'm looking for. And it's, that again, obviously in a personal context, no problem. But in a professional setting, it does make me extra anxious that this is going to happen to me if I'm on a stage or again, I'm doing a very important client, meeting.
Right.
So I feel it more definitely now than I did at the beginning.
I'd like to revisit what you mentioned about like finding resources. And for more background for you, Kay, so Amy, she is in remission now from triple negative breast cancer. She was diagnosed a number of years ago and now has since been diagnosed with melanoma. But what happens when you get diagnosed and you're overwhelmed, you have limited people kind of helping you, you have to advocate for yourself. Where did you even begin to access these resources or navigate all of that? Because it's just a lot coming at you. How would you describe all of that?
I literally Googled. I really didn't know where to start. I had asked my OBGYN. She was actually at the end. She was just starting to retire. And I said to her, do any of your patients, have they gone through this and do they have a recommendation? Because honestly, you Google and you're like, how do you Google it? Best oncologist? I didn't even know I had to go to a surgeon, by the way. I was like, oh, okay. Best oncologist. And you find all these weird lists on some publication. You're like, oh God, I don't know how to evaluate.
But then you might come across a rating that's bad because they had to wait or something. And
right.
Those are not I don't care if I wait. I want to know who's going to give me the most attention and care and best treatment. Yes.
Exactly. And even on the counterpoint in that, I realized 10 years later, sometimes I think bedside manner could be maybe a little bit of a red herring for perhaps other things that you should focus on, like how successful that doctor is. Because I've certainly had doctors who had great bedside manner, but I would say was probably taking their feet off the pedal a little bit on my treatment plan. So again, even looking at that, to your point, lay people's evaluation of a doctor is probably not appropriate, if you will. My OBGYN only had 2 patients ever in her very long 40-year career that ever got breast cancer. But she was very willing to reach out to that patient. I know, I was shocked. But she's willing to reach out. So she reached out to the 2 patients she had. She came up with a list at different hospitals. I'll be honest with you, I picked one of the doctors because the last name was Schnabel. And at that time, I had a colleague.
We used to work with this guy. Oh my God, he's great.
What's going on? But
he's just this really incredible guy we worked with, and it's not a common name, which is wild. Okay, that's so
I really literally just picked it based on that. I was like, you know what? I don't know, because there's again on the sheet of paper, don't know what's happening. Click. I was like, Dr. Schnabel, and that's Dr. Freya Schnabel, who I named my kid after.
Oh my God.
I met her. I knew she was the one. And also, ironically, again, I am not a woo-woo person, by the way. I was not looking for signs. I was like, okay, who are we going to do? Her admin at the time's last name was Soltrin.
Oh my God, shut up. And that's the name of his admin.
That was the name of his admin.
Yes, that's the universe. Yeah. Kay, you have to be woo-woo now.
Yes. And guess what? She was Stephanie Soltrin's aunt.
Oh my gosh.
It
What
was
a
all
small world.
coincidence. So it was like a small world kind of coincidence, but I didn't pick her even just because of woo-woo. She was absolutely the best surgeon. And as I went on in my plan, she found my cancer twice. I had heard from actual doctors all over the world that she was, best in class. And had they been diagnosed, they would actually go to her as well.
Validating. That's great.
Yeah. It really was haphazard, but that I think highlights the fact that no one can find care. And even when I found her, I didn't know what to ask. I was like, oh, okay.
Right.
Like, what do I do? Google. And it was through talking to another colleague, Thomas Puckett, who, if I could, I'd love to give him a shout out because he's also going through another cancer battle
You just
now.
did?
Yeah.
Good job.
Sorry, Thomas.
Yeah. Oh my God. He's the best. His partner, and him reached out to me and said, hey, you don't know how to find resources. We work with cancer care. So his partner volunteered quite a bit at cancer care and donated a ton of money. They put me in contact. I found a social care therapist there, who then connected me to a huge abundance of resources. And that's when I started to understand how to put things together.
Yeah.
But I really thought, oh my God, if you didn't have the resources, you didn't have a Thomas Puckett in your life and you didn't have all these, how would you find any of this stuff? So I think that's still a huge gap. And it's still 10 years later, I hear that that's the biggest,
it is a huge gap.
Hurdle.
Yeah. There is a statistic we had on another episode that it's not that the resources aren't there. It's something in the 80% of cancer patients don't actually know there are resources for what they need. So it's that information, the funnel of information. Are they ready to have the information and how are we getting them the information, all the things.
So it sounds like you had no problem asking for help for anyone, casting a net, asking for help, Googling, obviously. And now it seems as though you've been an advocate. We're not a political podcast, but I would like to touch on your experiences navigating the insurance system. And I know Amy, prior to being diagnosed, was her mom's primary caregiver when her mom was diagnosed with cancer. And she has a medical background. She's a physician's assistant. And she had a hard time navigating her mom's insurance. So it's there's these people who they play a little inside baseball. They can't even do it. You're a go-getter and it's difficult to navigate. So let's hear a bit more background on all of that and your story with that.
So I was very lucky to be born a Canadian. So I was born in a different system. And I think that probably highlights my philosophy because I've grown up in a place where there's a lot of social assistance and social programming around healthcare. And just the philosophy for healthcare is that it's a public good. And so I have this in my heart where I believe that everybody should have access to it. So it starts from there, the fact that I'm Canadian and I know a different system. And I think the second part of it is not understanding at all the insurance. So to be candid, when I was working where we worked together, Kristen, I never had an issue with insurance. I didn't understand the different systems of insurance. I didn't understand self-funded versus fully insured. I didn't understand private versus the Affordable Care Act. I just didn't understand it. And it wasn't really until I left that company and went to another company with a different system that I was shocked. A lot of medication and treatment that I felt was standard of care, not crazy, was being denied all of a sudden.
Right.
And that is when my eyes started ding, 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 ding. And I even had, this is a very big multinational company. That company actually one of their charitable causes or a social good is focused on breast cancer. And even the very top, the president and founder of this company seemed to have a lot of issue influencing the insurance company because they'd really stepped in on my behalf to advocate for me to have access to some of this diagnostics and some of this medication. It was shocking to me. And that was sort of the start of it. And as I moved on to other employers, I felt the same thing, but it seemed to have gotten worse over time. So the first thing I say that I'm Canadian, so there's the context. Second thing is I'm a middle child. So I do not like unfairness. I'm it is not fair. It is not fair. I don't understand. This is not fair. There's precedent for my medication being covered. And this is baseline diagnostics, a normal PET scan, for God's sake. Especially at a stage 4 cancer patient. Yeah. They're all being denied. And there were so many barriers for me getting access to the care. It made me really mad. And I think to your point, I have all these resources. I have a network of people. I had friends whose parents were healthcare lawyers who looked at, everything. I have good education, so I can understand things myself, understand how to use, look at government resources. I speak English, which again, we all take for granted, but that's like a big part of it. I probably have like the emotional aptitude and grit to sort of go for it. And so all these things made me think this is not fair, because even me in this privileged state, I'm having trouble to have access, much less anybody else who might work an hourly wage and still have insurance, but might not have a big company that can advocate for them. Someone who, again, has doesn't even have access to maybe like digital portals. That's how people die, frankly. It's not even adverse outcomes. I think that's being polite. I think a lot of people die because of this lack of access. And what makes it so egregious to me is that we live in a country where it's very rich, and that we have so much medical innovation, and yet nobody can get access to it. And I think that really frustrated me and starting me on my journey. And it really started with one medical director at an insurance company telling me during Breast Cancer Awareness Month that because I had been stable, that I would not be eligible for a PET scan, which I was like, I'm a stage 4 cancer patient. Like, what? And I was so mad, because I'm thinking, all my sisters out there that face breast cancer, absolutely not on my time. Like, absolutely, I cannot take this as fact and fiction that a man who is, by the way, retired and probably not even licensed from an insurance company is telling me that I'm not allowed to have access to a standard diagnostic tool, like standard. And that like infuriated me to no end. And it sort of kicked up like this desire for me to start somewhere and probably get a lot more news around it.
Yeah.
So what was your platform?
To be honest with you, I was just so mad that I was like, I'm going to call press. I don't know what I was doing, to be honest with you, but I started out everywhere. ProPublica. I was like ProPublica because they did a lot of like expose is probably the wrong word, but they did a lot of great journalism on the state of our healthcare and sort of all the incentives that there are in a sort of capitalistic healthcare. So I started with them. I even did like local news.
Yeah,
like,
I remember that.
Consumer Reports. I went to Consumer Reports. I reached out to everybody, and I went to my network and said, hey, does anybody have access to a reporter or journalist who might be doing this? I went on Reddit and I started messaging all the journalists who were looking for leads. And one person, Gretchen Morgensen, picked up on it. She's this incredible Pulitzer Prize-winning journalist. She's at MSNBC. She was on vacation and just saw it maybe on her phone and said, hey, I'm on vacation. I want to talk to you about this. So she was the only person that bit. And I have been working with her ever since. It's something that's very passionate to her and even to some folks at some of the partners that she works with. But from then, I was able to get the ball rolling. And honestly, timing around some of the news around some of the unfortunate things that happened at United Healthcare was what actually elevated it. Because we had been planning for sort of this piece on how healthcare denials really affect people. We'd been planning it for a couple months before that happened. But I think just the timing of that brought much more awareness around the issues that a lot of people with insurance face.
So I had a follow-up question about all of that.
While you think of that, can I just say that I love that the catalyst of this story is I'm picturing like Mr. Burns. Like Mr. Burns on the phone with you, giving you the information, and you're like, fuck no. And then off you go.
Oh, by the way, this man, I'm going to say, like, still looks at my LinkedIn. And sometimes,
what?
Yes, I do.
What a psychopath.
Does he know that you can see that he's looking at his LinkedIn?
They were very worried. They were very worried that in my broadcast, in the broadcast of this particular piece, that I would name the medical director. But it was very interesting because from the insurance company, which was the Big Four, had actually reached out to ask that I not disclose the name, which was, again, very interesting because names were changed. And then subsequently, even with insurance companies, I've had denials still from that insurance agency where they would blind medical directors, which I think is...
Let Me Know If You Need a Podcast is sponsored by Gift Well Soon. Do you have a friend who needs help but is too overwhelmed to ask for it? Let Gift Well Soon do the asking for them. Gift Well Soon, the care registry for life's toughest moments.
I also think that's part of the aftermath of what happened with United too. Like there's this fear, and maybe that's a big sign that something needs to change. If you're scared to be affiliated with this, like maybe it's time for change. So I have a question. What advice do you have for people to like advocate for themselves? I mean, maybe maybe they're lazy. That's a wrong one to say. Like maybe they don't have the energy to, Google or research, or like they just take what they are given with face value. Like what words of encouragement or wisdom do you have to impart on someone going through that?
Before you answer that, I think that from my experience as a medical provider, I think people don't realize what they're not getting because they don't have enough information. And so a lot of times, like, let's say a PET scan's ordered and then your physician gets the information that's not covered. And then the physician calls in, like the nurse or whoever, the MA calls in like, hey, it's not covered at the time. We're going to bump it 3 months and we're going to try again. And the patient's like, okay, because my doctor called and my doctor told me, I'm accepting
you're just following the rules, right?
Like, not their fault, but like to Kay's point too, is that a lot of times they don't even know what they're not getting because it's like the physicians don't have time. They know the system. They know they have to play within the constraints. So it's like this whole ugly.
It's a rigmarole.
Yeah. Sorry.
You got to be wily. Because after my last couple of denials, I noticed that the medical director's name was no longer there. And I asked for the license because it is your right under at least New York State. You have a right to know whether or not that physician is licensed in your state, active license, and also in the area in which they're denying, which sometimes is not. I had an earlier denial at the last employer where it was a podiatrist who denied my cancer treatment. I'm like, absolutely not acceptable in any way. But they deliberately blinded this. And Amy, to your point, like I pushed and pushed. And it, I was working with a chief business officer at this insurance because they were really nervous about how loud I was being about all of this. They tried to,
Cappy's like, I'm loud
sure. Too. I know. No, just as mad about this. But what had happened is I actually pushed and I said it was against the law. I cited law. I showed them the law. They still refused to release the medical director's name. And finally I said, guess what? I can still find it through HIPAA because I can find out whoever touched my file and I can still find out who it is. But again, it's because I've been through that process and I'm so angry about it that I had to dig deep to understand that. But there's so much complexity to the process that a normal person who's not as mad as me would not know. You would just be like, oh, you're not going to tell me the medical director's name, or they don't even know there's a medical director.
Yeah. They don't even know they have the right to know, or yes.
Yeah.
And they will use like sneaky language to make it seem like you don't have the right to know. And then if you haven't had the time to do more information, or you don't have the information, you just don't have access, right? Or understand.
Yeah, absolutely.
So what's been the outcome?
The outcome is I did get 2 public apologies from this company, which is big, but they kept on denying my stuff. So they kept on denying. I would say I think a net very positive outcome is my current employer. Definitely, again, I'm just one of a lot of like issues with this particular insurer. A lot of like employees had risen up their voice and like really made sure that the feedback was shared, that the coverage was inadequate. And so subsequently, the employer had actually made a big decision to change insurance providers. I think that's a net positive. At least we have that. But altogether, I have a lot of feelings about private insurance because it's so much less regulated. In a way, it's in some way even worse than a government funded, because with government funded, you at least have recourse with the government who's paying, right? Or to some degree. Whereas with private insurance, there's a lot of opaqueness around it. And it really depends on like your employer, like their ability and how big their account is and whether or not they're self-funded or fully insured. So I think all to say is that, again, this is not political because I think it's bipartisan. It's like people with health issues. I think the system does not work. It does not work because there's too much complexity, there's too much inconsistency, and at the same time, there's no recourse, particularly with private insurance, which most people have in this country. So yeah, I think it just doesn't work, and I think it's sad. And I think the lack of regulation, which I now understand why, you got to give something to have ACA so that more people have insurance, but I think some of the lack of regulation on private insurance is a fairly big problem, and I think people suffer because of it.
Yeah.
Well, I just have to say, I love an angry woman. I think angry women get shit done.
Oh, you gotta get along.
So
constantly angry.
Before we wrap up here, I want to make sure everyone knows where they can find you if they want to follow, reach out. So we want to share your handles or details. By all means, if you have anything to plug, please go.
Yeah. KayHsupReme. Kay Supreme. Listen, you get stuck with what you get stuck with, Yeah, definitely on LinkedIn as well. It's kind of a weird thing to push out.
We'll put it in the show notes though.
Yeah, we will put it in the show notes, but, and you can find her on MSNBC. The articles are out there in the ether, so look her up there too. It's pretty inspirational. So I appreciate that.
Actually, I forgot to mention. Sorry, it's the last thing.
Please.
Gretchen, because of that article, and because there was so much attention, they actually started the series. So NBC and MSNBC have an ongoing series where they feature a case study, again, to bring a lot more awareness about sort of these issues. And that, again, not because of me, but as a result of the outpouring of, I think, response to it that's happened. So I think, again, there's more and more awareness, which is awesome.
Yeah.
And if I'm going to give a plug, Cancer Care. Cancer Care, longest standing not-for-profit for cancer support. They don't focus on research, which is, again, very specific, and it's great there, but the research tends to get a lot more funding. Cancer Care provides a lot of free social support. They provide language services. They donate a lot of wigs or clothing. They help with the assistance around people who have cancer. So helping people get rides, translation services, helping to provide access to care. They also do a lot of policy work. So working with government and regulators on, again, helping to reshape and reform our healthcare system. So if I can give them a shout out, donations, or again, send a loved one to there. All of this is free, by the way. So what I think that they're doing is God's work, because we can focus on definitely addressing cancer, but and preventing it in the future. But we also need, not-for-profits and services that really support people and caregivers with cancer. So that's a big shout out to Cancer Care.
Well, thank you for that plug. We'll include that in the details of the show as well. And then we like to close with one question that is near and dear to my heart as a food lover. When you were going through treatments and, people were showing up in different ways, and oftentimes that people show their care and love through food, what is your favorite comfort food?
McDonald's.
So interesting, because you know what they say, Amy, I don't know if you did go through chemo, but when I did they did say to you, don't eat the thing that you love, because your taste buds get all wonky with it.
Oh, no, they didn't say that. They just were eat because it's better to eat than not eat. Don't worry if you're unhealthy, all those things. Of course, I worried that I was unhealthy, and I literally ate vegetables for 3 months straight.
I did too. I drank this cauliflower soup. It sounds so weird, but I would take cauliflower, boil it, and then I'd put some chicken stock or vegetable stock and then blend it and eat it. I was obsessed with it the whole time. And the minute chemo started to change my taste buds, now I feel revolted when I think about it.
Yeah.
They think it's psychosomatic, but also maybe something to do with chemo. So that was definitely my comfort food. And I ate a lot of miso cod.
Oh, interesting.
Yeah.
Random. Very random, but yeah.
Do you still love the miso cod?
That I do. But somehow I have this crazy aversion to something as normal as cauliflower soup. Now I'm ugh. I somehow feel the metallicness in the back.
Yeah, that metallic.
Even after 10 years, I'm oh,
yeah.
It grosses me out. But, I'm a very healthy weight. Now these days, I love all the food. So definitely miso cod's still there, but definitely sushi stays on top.
Oh, amazing.
God, yes, I love sushi.
Love sushi. Amy and I talk about sushi quite a bit. So thank you so much for your time today. We really appreciate you sharing your story, getting real with us, and getting fired up. And we look forward to following up with you, hopefully in a later episode.
I'd love to. Thank you for having me.
Thank you.
Kay.
There are so many great takeaways from that conversation. A big one is to keep your appointments. And another one that really stuck with me is how important your network can be in playing a role navigating a disruption in life. Also, it's okay to ask questions. It's absolutely okay to get angry, and to use Kay's words, wily, which I absolutely loved. Her journey has transformed her into a fierce advocate for patients' rights in the insurance system. And I think we all know that these systems have a long way to go, and we're going to do our best, right? So you can find Kay online on Instagram at Kay Supreme, which we'll put in the show notes. And I also want to give a special shout out to cancercare.org. It's a organization that Kay she advocates for as well. If you know someone who's in need of some resources based off of treatment or a recent diagnosis, please share that with them. Or if you're so inclined, consider donating to cancercare.org. And thank you for listening. Remember that asking for help is not a weakness. it's sometimes life-saving. So let me know if you need to get wily, because I'm a fighter, not a lover. Take care.